City officials are making plans for access to the coronavirus vaccine. It's currently being given to Boston's first responders, but the goal is to include the general population. Part of the challenge is overcoming a reluctance to accept the vaccine, a feeling that could be strongest in the Black community. The city's developing response to that, which was mentioned yesterday by the mayor's chief of Health and Human Services, Marty Martinez.
Not surprisingly, and I know folks know this, but we continue to see hesitation in our diverse communities and our Black and brown communities here in Boston to get vaccinated. So we're partnering not only with our hospitals and health centers, but community-based organizations to continue to raise awareness about the vaccine, its safety, how it was studied, and to do everything we can to ensure folks get vaccinated when they're able to get vaccinated.
Skepticism about the vaccine follows a long history of distrust in the medical establishment by African Americans, as well as their experience of mistreatment. But a new public opinion survey shows the sentiment still fairly strong among people in Boston. Among the collaborators on the survey with the Boston Public Health Commission was the Center for Survey Research at UMass Boston. To tell us about it is the center's Interim Director, Lee Hargraves. So thank you very much for being with us, Lee.
You're welcome. Thank you.
Lee, I want to start with your blanket figure of only 20% resistance to getting vaccinated in Boston. You know, for a person who follows sports and politics, 80% positive, that sounds pretty good. But if you're trying to vaccinate people and essentially render a virus harmless, how good is that?
Well, from my perspective, you know, and again, this is what I hear from the folks at CDC and others. You know, you want to get up to 80 and even more. 90% would be better. I mean, that's one of the, you know, everyone hears about, we need to get enough folks immunized to make it so that the virus and the pandemic gets sort of pushed down. And the only way to really do that, well, one is, you know, masks and social distance, which we hear pretty much every day. But the other piece of that is when your time comes to step up and get vaccinated.
Well, looking at the different public attitudes by racial groups, there is a very significant difference. So can you tell us what that is exactly?
Right. So what we did in our survey, and again, our survey is of Boston residents, but it really resonates with what one would see if you look at national estimates for reluctance. I mean, that's one of the pieces of the puzzle. And again, as you pointed out, African Americans are reluctant. And, you know, that hesitation is somewhat because of history and the past. You know, we talk about inequities and injustice, and members of communities of color are much more aware of the history of that than the general population. And by that, I mean, there have been things that have occurred over time, I mean, going back hundreds of years, and not ending until the 1970s, when there were still experiments and being done in which, you know, African Americans were mistreated. And I think that sort of resonates, and that's a piece, but it's not like, it's something that can't be overcome. I think, you know, one of the things, and as you mentioned, working in the community is really where the action is, and where, you know, folks need to focus their efforts. I mean, that's one part of it.
Well, I know there are community leaders in Boston who expected a result like this, and they're certainly aware of the importance of getting as many people vaccinated as possible if you have an effective vaccine. So what's the next step beyond that?
Right. I think, you know, I mean, as you point out, this is a piece of, you know, it's knowledge that everyone's kind of aware of. And one of the parts of that is, you know, having trusted members of the community, people I know, my neighbors, who are working and getting vaccinated. I mean, it's at the community level, I think. You know, it's great to have people on television from the CDC and Health and Human Services pointing out that vaccines are important, but a lot of the hard work will be done, you know, through faith communities, through membership in social groups, through family and friends, and sort of getting the word out. And I think the other point I wanted to make is, you know, we did our survey back in September. And one of the things that is going on at the national level, back, you know, in September and October, there was a lot more reluctance. And as things roll out, as again, there's this strong message that there was a lot of work that went into this vaccine. This vaccine, it's built on decades of research. It's built on the shoulders of the giants in biomedical research. And that's one of the reasons it came so quickly. And by now we're getting a little bit more, there's more and more people every day who are saying, when it comes time, I will get my vaccine. And I think that's what's going to happen at the community level, as I see my neighbors and my friends and my mother-in-law gets a vaccine, and that's going to help considerably. That's the other part of it. At this point in the pandemic, most people I know someone who's been affected by the virus. A lot of people I know have a friend or a relative who's died. And that's the push. It's sort of a trade-off between, I don't want to get a vaccine. I mean, who likes to have people poke needles in their arm? On the other hand, the other side of that equation is I really don't want to get a COVID infection.
I want to ask you one more question about the timing of the survey, because before September, and not much before that, we were reporting about people trying to make the clinical trials for the vaccine more racially inclusive. Several months later now, we have these vaccines that are being given to people, and we know how well they're working, at least certainly a lot more than we used to know. What do you think that could mean about public sentiment?
Well, I think that's very helpful. I mean, in the history of medical research, I mean, this is, decades and decades, there has been an effort to be more diverse in all of the trials that are being done, and not just based on race, but based on gender. I mean, for decades, there were heart studies done on men. Women have heart disease too. So there's a very strong effort, particularly with the National Institutes of Health, to make sure that all of the clinical trials that are being done, the participants look like the population.
Speaking of gaps, there is a gender gap around acceptance of the vaccine, in addition to an age gap. What about those?
Well, I mean, it's not a huge gap, but men were more likely to say that I'll definitely get a vaccine when it becomes available. Women a little bit less, but not a huge difference, but it's still there. So that's one of the reasons why, again, when you talk about the clinical trials, these clinical trials, they were huge. I mean, thousands and thousands of people participated in the vaccine research, and they stepped up and they volunteered, which is one of those wonderful things. I mean, I volunteered for research when I was in grad school. I think, if you have an opportunity to participate in a clinical trial and you're part of the population of interest, then why not try it? Because that's going to, in the long run, help to convince everyone that, when I look at who participated, it wasn't just, middle-aged white guys like me. It was a broad spectrum of the population, and the vaccine seems to be incredibly effective.
I'm also intrigued by what you might call a gradient of fear, and you have done other surveys, including those that shows there were more fears of infection among certain parts of the population in Boston. It's interesting how that fear of infection, maybe just coincidentally, overlaps with fear of the vaccine. How can you account for that?
Well, that's one of those things. I mean, I'm an analyst and I look at data. And I thought, we asked the question, how worried are you about infection from the coronavirus? And, like all surveys, we have, not at all infected, not at all worried, very worried, and extremely worried. And one of the surprising findings, I thought, the more worried you are, the more you're going to want to get to be, I want to be in the front of the line because I'm worried about not just me, but my family. But one of the things that we found is, yes, there is a greater percentage, the more that people are worried, up to a point. The people that were extremely worried about becoming infected, they were a little bit less likely to want to have the vaccine. And this is one of those things about social science. You get a result and you want to try and explain it. And one explanation, and again, we would have to test this in a future survey, but one thing that we kept thinking about is extremely worried. You're extremely worried, but you're also probably worried about a lot of things. And, you know, you might be worried about the vaccine. I mean, again, everyone has talked to their family and friends, and someone has said, well, I got a flu shot and I didn't feel good the next day. And so that makes people a little bit more worried about flu shots. But this particular vaccine is completely different. And, you know, the testing has been different. And so I think that, you know, being extremely worried means that someone who's going to be talking to the person who really might want to get a vaccine. I mean, we know the populations, older people, people with chronic conditions, they need to be vaccinated. So if you're really extremely worried about that, perhaps the person that's talking to you, you know, and again, I'm talking about healthcare professionals and again, community health workers, which I could talk about a little bit too. But, you know, one of the things they can do is ask people, you know, tell me a little bit about why you're concerned. Why are you worried? And have a conversation about that. I mean, one of the things about trying to get people to do the right thing is to have a conversation and not tell people what to do. I mean, I was a teenager once. If you told me what to do, I probably would not listen very much. But if you said, you know, what are you going to be doing? And let's have a conversation about that and tell me a little bit about what you're worried about. And I can give you some information if you'd like to maybe help overcome some of your fears.
What about the importance of additional information? Because in one of the earlier surveys, you found that there are people in Boston who were very supportive of wearing masks. They generally got the message about distancing, but a lot of them, it just didn't register with them that this disease can be spread by people without symptoms. So how important is it to help people understand something like that?
I think it's essential that, you know, people kind of step back and say, what's going on here? We have a virus that's spread by word of mouth. And, you know, if I cough or sneeze and I'm not wearing a mask, bad things can happen. Because, you know, we also ask people if in our survey, you know, do you know that you can pass, a person can pass the virus from one to another without actually having symptoms. And one of the things that we found was, you know, a lot of people were very aware of that, but there are a small number of folks who don't kind of get the bigger message that I can feel perfectly fine, but yesterday or 5 days ago, I was exposed. I'm not symptomatic, but I still might be a spreader. And so every time we look on the news and see a large crowd of people, and they're not wearing masks, there's a little part of me that's like, oh my goodness, what you know, here we go again. I mean, we're seeing that right now with the surge that seems to be going on. Everybody had a great holiday season, but a lot of people went out and had parties, and now we're paying the price for that.
Well, thank you very much for taking the time to join us.
You're welcome. It's a pleasure to be here.
That was Dr. Lee Hargraves from the Center for Survey Research at UMass Boston. We'll have more news in just a moment.